health reasons why 26-year-old Sarah Kasich, who had travelled to Brisbane from the ACT, should not be granted an exemption to attend her dad's funeral today? And do you think it's good enough that modelling from your own department shows hundreds of millions of dollars in promised funding for aged care will only amount to 300 additional aged care packages by 2024, despite there being over 103,000 people on waiting lists for care?
Sure. Look, in relation to Sarah's case, I know that the Prime Minister and myself and so many others are urging the Queensland Government to show compassion. This is a very difficult situation, and somebody facing the loss, the agony that Sarah has faced, as we all do at different times in our journeys, I think is deserving of compassion. And we have quietly worked behind the scenes on many cases with many states and had very strong, compassionate outcomes. And I would gently but clearly urge the Queensland Government to show compassion in this case. In terms of the home care places, what we've seen is that we have added over $3 billion in the last 2 years to home care. There were approximately 60,000 home care places when we came to government. Over the course of this budget cycle, we'll see those numbers rise to approximately 164,000, or more than a 150% increase. And we've in fact brought forward many future increases, and we'll continue to provide additional places, whether it's at each economic update or in response to the Royal Commission. But we haven't waited. We've got ahead of that commission, and we've continued to provide places, indeed new places having been recently announced. And what we do use as our guide is the capacity of the sector to safely deliver people who are well trained, who are in a position to provide the services, and as we bring forward that training, we'll continue to provide more places. Claire.
Thanks, Minister. Just following again this specific border case that we've been talking about today, but the issue more broadly as well. Firstly, the Queensland Government has just confirmed that Sarah will be able to have a private viewing at the funeral home after the service, but will not be allowed to attend the service itself. Seeking your reaction to that, I guess, compromise. And secondly, the government has long held that decisions like this made on medical grounds, that there should be more transparency on why those decisions have been made. Are you satisfied with the reasons that the Chief Health Officer in Queensland has been providing on these cases that have been denied exemptions?
On the specific case, I haven't seen the Chief Health Officer's ruling or reasons, so I think it's important for me to be clear on that. Generally, what we would like to see is a very transparent system. So there is a capacity to appeal for exemptions on compassionate or other grounds, that there is an initial assessment which is done, and that there is a transparent process to make that appeal. Obviously, I think the most sensible and sensitive and compassionate thing to do with regard to Sarah's case is if, in a COVID-safe way, obviously masked and with any other appropriate distancing, Sarah were able to attend the full funeral. I think that would be the most humane and the most decent and the most compassionate thing to do.